right. Well, we will get started. Hello and welcome again to another Move with the Doc Talk. Just to introduce myself, I'm Dr. Rupa Shah. I'm a board certified family physician and a health and wellness coach with over 20 years of patient care experience. So as we've done previously, I'll just chat with you today about some diabetes talk, and just feel free to move, stretch, get down on the floor and do some good stretching, to kind of loosen up those muscles. Or it's a beautiful day outside, and if people, if you're walking outside, yeah, just get outside and move your body as we talk today. So we're going to talk about something today that most of you have heard about, or even know somebody, or maybe you yourself have a diagnosis of, and that is diabetes. Specifically, I'm going to focus mostly on type 2 diabetes today. I'm going to mention type 1 diabetes, but the focus is on sort of that adult onset type 2 diabetes. This is a diagnosis that I, of course, see in the office quite frequently. And in a lot of cases, it can be preventable. And so that's kind of what we're going to talk about later in the talk today. So let's just, start out. What is diabetes? So at its core, what I want you guys to know is that at its core, type 2 diabetes is all about insulin resistance. So that's kind of the buzzword, the key phrase I want you to take away: insulin resistance. So what does that mean? The body does not respond properly to insulin, and your blood sugar will rise. Okay. So this high blood sugar then over time is just not great for our body and all of the different organ systems. So specifically, it'll start affecting the heart, your kidneys, your eyes, the nerves in your extremities, your feet, wound healing, all those types of things from that really, really high blood sugar over the years will start having a really poor impact on your health. So how does it begin? And remember, the key phrase was insulin resistance. So what does this mean? So insulin is a hormone, okay? And it's made by your pancreas. And that's where it acts like a key to sort of let that blood sugar into your cells and allow your cells to use that blood sugar for energy. But in type 2 diabetes, your cells don't respond normally to the circulating insulin that you have, that your pancreas is making. So what does your body try to do? It'll try and make more. Your pancreas will say, oh, I just need to keep making more and more and more insulin because I see this blood sugar rising. And eventually, I sort of refer to this as your pancreas just like burning out. And it can't keep up. It can't keep up with the demand. The blood sugar starts to rise. And then this sets the stage for prediabetes and then eventually type 2 diabetes. So let's just pause for a moment and just think about that. So it's a state of insulin resistance. It's a state where people actually have a lot of circulating insulin. Insulin is not the problem here with type 2 diabetes. It's just it can't keep up with the demands of your body. For instance, the foods that you're eating, or if you have a larger body weight, you're requiring more insulin from your pancreas. I just want to briefly contrast this with type 1 diabetes. So type 1 diabetes, or often referred to as juvenile onset or seen more often in children, is truly an autoimmune disorder. So it's very different. The body has actually decided to start making antibodies against the insulin. So it's not, it's not an issue where there's all this insulin. It's that the body is producing antibodies and the insulin is just not there and effective to be able to be used. And so therefore, those patients need to inject insulin because their body can't make it. So again, this is not the case in type 2 diabetes where there is lots of circulating insulin. It's just, again, your body isn't using it effectively. So now that you know that it's all about insulin resistance and your pancreas not being able to keep up with the demands, let's talk about what some of the signs and symptoms could be. And it's really important to realize that because it starts so slowly and can take many years to develop type 2 diabetes, a lot of people won't have any symptoms at all, okay? And that's why it's really important when you go to see your physician or your provider for your physicals that one of the tests you get done is a fasting blood sugar, because sometimes that can be your first clue that you're developing that insulin resistance, okay? So a few of the symptoms you might notice, and you've maybe heard some of these before, but going to the bathroom a lot, increased urination, feeling thirsty, maybe you're noticing weight loss and you're not even trying. That's not okay. That could be a symptom of type 2 diabetes. Dry mouth, blurry vision, fatigue, just feeling really kind of tired. And I know that's a really common symptom, but if you are having that, it's worth getting your blood sugar checked. If you're starting to notice any numbness or tingling in your feet or any funny sensations, another good reason to get checked out. Or in general, for especially for women, if you're noticing more urinary tract infections or yeast infections than you've had in the past, just get that blood sugar checked with your doctor, just to be sure that that's not an early sign of diabetes. Again, I've talked about it before, but it's a really simple blood test. It's what we call a fasting blood sugar. Fasting means you should not have had anything to eat or drink for at least 10 to 12 hours. That makes it a really good, accurate fasting blood sugar. There is another test called a Hemoglobin A1c, which also can be helpful in the diagnosis. And typically we use a cutoff of 6.5%. It's sort of resulted in percentage values. And anything above 6.5 is considered abnormal. Anything between the 6 to 6.5 range, I consider pre-diabetes, and we start having talks about what we can do to prevent getting diabetes. So let's move on to what are some of your risk factors for developing type 2 diabetes. Some of these are going to be quite obvious. Again, if you have pre-diabetes, you're going to be predisposed to getting type 2 diabetes. If you are overweight, anyone actually over the age of 45 is more at risk. If you have a family history, so if you have a parent, a brother, a sister, grandparents, or just a really strong family history, make sure this is something you're getting looked at each year at your physical. If you're physically inactive and you're not moving more than 3 times a week, here's a really important one some women don't realize. If you've ever had gestational diabetes, that means if you had diabetes during any of your pregnancies, or if you gave birth to a baby who weighed more than 9 pounds, so those are really big babies, there's some thought that those women may have had gestational diabetes, and that does place you at a very much higher risk of developing lifetime type 2 diabetes. And then if you're from one of these high-risk groups, African American, Hispanic, Native Americans, or Alaskan Natives, and then also any Pacific Islanders or Asian Americans are also seeming to be at higher risk. So if you do fall into any of those groups, it's also a great idea to get checked out. So, and the physical exam is usually the best time to do this, because that's a lot of times where you're getting some of those other maybe cholesterol fasting done, thyroid testing, other things like that. So let's say that you are sort of listening and you're like, oh, I have some of those risk factors she just mentioned, and it also runs in my family. So I don't want to get diabetes. What can I do? So let's talk about some of the things that we can do to prevent getting type 2 diabetes. And I do believe that, in fact, most people can make lifestyle changes to avoid getting type 2 diabetes. Now, that's not always the case. There is a strong genetic component to it, and sometimes these things aren't going to work. There is also a latent onset type 1 diabetes. I don't want to get too much into it. It's called LATA. It's sort of a hybrid of a type 1 and a type 2, and it does affect older adults who are thinner and have a different body habitus. And that's sort of a different category. It's a little bit more rare. And those folks do typically end up needing some insulin to get treated because there's a little bit of a component of an autoimmune, but also with that really strong insulin resistance that we talked about with the type 2 diabetes. But let's get back to just strict type 2 diabetes and how we can avoid it. So first, and probably the most important, is cutting out sugar and those refined carbohydrates from our diet, and basically just reducing the amount of processed foods that we eat. So when you eat those foods, okay, so let's say you eat a candy bar or even like a bagel, okay, so those that food gets immediately broken down into all these small sugar molecules, because carbs in essence are sugar molecules all linked together, okay? And then that all gets absorbed, all that sugar gets absorbed into your bloodstream and your blood sugar rises. So your blood sugar rises, your pancreas recognizes this and says, okay, time to make some insulin. That's that, again, that hormone that helps get that sugar out of the bloodstream, and then moves it into your cells again, okay? Now, in people with prediabetes, the blood cells, again, we talked about, are going to be a little bit resistant to the insulin action. So the sugar is going to stay high in the bloodstream. So if we then measure the blood sugar an hour later, we're going to see it still pretty elevated above what a normal person's blood sugar would be after eating. So again, to compensate, the pancreas produces more insulin, trying to, again, keep bringing that blood sugar down to a healthy level. And then over time, as we said, it's going to lead to higher blood sugars, higher insulin levels, until we finally develop type 2 diabetes, because the pancreas is like, you know what, I can't keep up. I can't keep doing this because this person continues to eat these foods that are really stressing, this organ. So lots of studies have shown the link between frequent consumption of sugar, refined carbs, and the risk for type 2 diabetes. So if you can replace them with foods that have a less of an effect on your blood sugar, you're going to help reduce that risk. So what are you going to replace it with? So healthier options, and usually this is going to be foods that are higher in fiber. And we've talked about this, I think, a little bit in the gut microbiome talk, and just talking about how important fiber is in our diet, especially an American typical diet. So we know, again, how important fiber is for weight management, for our gut health, but in studies in elderly folks, obese individuals, and pre-diabetic individuals, fiber has been shown to keep the blood sugars and the insulin levels lower, and thereby reducing the risk of developing type 2 diabetes. So again, fiber, we have insoluble fiber and soluble fiber. Soluble fiber, you absorb that water. Insoluble fiber, you don't. So in the digestive tract, the soluble fiber and water form kind of this gelatinous material, and it slows down the rate at which food is absorbed. So this leads to that really gradual rise in the blood sugar instead of that huge spike that you get. Like if you were to eat a bagel, it's going to be a huge spike. But if you ate yogurt or something different, you're going to get a gradual rise in your blood sugar, and that's what we want. Insoluble fiber has been linked to reductions in blood sugar levels, decreased risk of diabetes, even though we're not exactly sure how the insoluble fiber may work, as well as the soluble fiber, but both are good. So you want to add more peppers, mushrooms, vegetables like asparagus, broccoli, spinach, all that fibrous food. Fruits. Fruits are tricky. Certain fruits are very sweet and do have what we call high glycemic index, and you can find these lists online. You want to choose even the fruits that have what we call a lower glycemic index, so they're not going to hit your system and help or make your blood sugar rise right away very quickly. Protein, also very good. Fish, chicken, turkey, tofu, eggs, really good sources of protein that are going to lead to a very gradual rise in your blood sugar. That's what you want. A lot of talk you always hear about whole grains. So whole grains, things like quinoa, brown rice, steel cut oatmeals. When you eat these foods, it's harder for your body to break it down. And it takes a little bit longer to digest. So you don't get that spike in the blood sugar. It's a gradual rise in the blood sugar. And then of course you want to choose more water, unsweetened beverages. You don't want to drink a lot of sugar. And I will even say alcohol and wine. Red wine is nothing but, just an adult fruit juice that's really going to cause those sugars to spike as well. And then lastly, as we're talking about diet, just watch your portion sizes. Eating just too much food, even at one time, really can cause higher blood sugars and have your body try and produce more insulin to deal with that, okay? Second big category if we're trying to prevent diabetes is going to be exercise. Now, exercise is good for lots of things. So I'm not going to get into all that and how it can control your weight and stuff, but we know that exercise independently can improve what we call the insulin sensitivity of your cells. So yes, your cells can be more or less sensitive to insulin. So when you exercise, less insulin is actually going to be required to keep your blood sugars under better control. So that's actually very cool. One study, people with prediabetes found that kind of a moderate to intense exercise increased the insulin sensitivity by 51%. And if you did high intensity exercise, it increased it by 85%. But that effect was only then kind of lasted on the days that you exercised. So many types of physical activity have been shown to reduce insulin resistance and blood sugar in overweight, obese, and pre-diabetic individuals. So any type of aerobic exercise, high intensity interval training, even strength training can improve your insulin sensitivity. So again, I think the bottom line is that working out and exercising is going to improve your insulin response, your cell sensitivity to the insulin that you already have circulating. And so I would avoid being sedentary and just try and keep moving. And then last, I do think it's important to, say this, even though it's sort of a little bit obvious, but if you are overweight, working on that weight loss is going to be important at reducing your risk of developing type 2 diabetes. Again, I do want to stress, not everyone that's overweight is going to develop type 2 diabetes. And there are, again, those folks that aren't overweight and they do get type 1 diabetes or that latent onset diabetes. But most of the time, people with prediabetes tend to carry that excess weight in the midsection, which also means that weight or that adipose tissue is surrounding your organs, things like your liver, your pancreas. We call this visceral fat. And we know that that visceral fat is linked to more inflammation overall in the body, and then insulin resistance. And again, what did we say type 2 diabetes was all about? It's all about insulin resistance. So this, again, significantly having that excess body weight, that visceral fat, is going to increase your risk for type 2 diabetes. But the good news is that even just a small amount of weight, it doesn't have to be a lot, a small amount of weight is going to have a profound effect and help reduce that risk. So they studied 1,000 people with prediabetes and found that for every, even 2.2 pounds of weight that people lost in that study, their risk of diabetes reduced by about 16%, and the maximum reduction they saw was 96%. So it doesn't have to be an overwhelming thought of I have to lose 15 or 20 pounds. You certainly don't have to. Again, it's sort of like when we talked about hypertension, even just a modest reduction in your weight is going to improve those key parameters and help you get your cells more sensitive again to the insulin and help reduce that risk of diabetes. So don't get caught up in how much weight it has to be. It doesn't have to be. It's just small incremental reduction in your weight. So one thing I just wanted to mention really quick as we were talking about insulin resistance, let's say you are falling into that category and your doctor has told you, you're pre-diabetic, your blood sugars fasting are above that 110. I'll usually say 110 fasting is usually considered pre-diabetes. So let me back up. So between 110 and 126 is usually that pre-diabetes, okay? Above 126 is usually the cutoff that we use to say, now you meet the criteria for having type 2 diabetes. So keep in mind that 110 to 126 is pre-diabetes. If you fall into that category and your blood sugars every year at your physical have repeatedly been in that range, you can talk to your doctor. There are medications that we can use for folks who aren't diabetic, but are pre-diabetic. And metformin is still one of the tried and true, really great medications. In fact, I'll, talk to my patients about that. We don't want to wait until people have type 2 diabetes. There are things that we can do. And we already talked about them: changing your diet, exercising, working on the weight. And I will say certain medications like metformin, and there's some newer ones now out on the market. So talk to your doctor, but the first thing is getting in for your physical and getting those blood tests done so you can see where you fall on that. So Diabetes, unfortunately, is becoming more and more prevalent in our society in adults, and then unfortunately also in children, adolescents, teenagers. So we're starting to see more of it. But the good news is, I hope the message of today was that you have control over this. For the most part, of whether or not you develop type 2 diabetes. So I hope you've learned a little bit about diabetes, what it is, signs and symptoms, and then the key phrase again, it's all about that insulin resistance, and that's what you want to focus on reversing. So if you have any questions, please put them in the chat, reach out to me via email. I love that too. People have done that in the past. That's really great. Rupa.shaw at ssmhealth.org or .com, sorry. So feel free and reach out. I'm here if you have any follow-up questions or concerns. Thanks again for joining in, and I will see you next month.